Perfect. Hi, everyone. My name is Casey. I am a nurse and I work at Trusted Health as a community associate. Welcome to tonight's event, Medical Volunteering 101. I'm really excited to have you here and this really special topic with two really lovely. So, like I said, thank you for joining us. Please ask and upvote questions through the chat. You can use the Q&A function that you're going to see at the top middle of the chat. Place your questions in there. You can also upvote other questions you really want answered. So please use that function platform. It's really helpful for me when I'm sending those questions over to our host. You are here to listen, learn, and medical volunteering is right for you. Please feel free to ask questions. This is a safe space for everyone. So what exactly is medical volunteering? And then we'll have two different types of medical volunteering, how to get started, ethical considerations, and how to prepare. So with that, I would love to talk to one of our lovely hosts, Ms. Tayler.
Hey y'all, thank you so much for joining us. I'm literally so excited to be doing this. My name is Tayler. I'm currently a travel nurse with Trusted. I've been a nurse for about 6 years, a traveler for 4. I've also done a pretty significant amount of aid work. So I've worked in 7 countries and visited 21, and that was all in the last 4 years doing aid work. So I consider myself still kind of a newbie to this world, but very excited to learn and get to know things. My specialty in the States is pediatrics. I've only ever worked peds in the States, but I've done lots of things overseas. And then let's see, Casey, if you want to go to the next slide, I think it says, yeah. So this is what I've done as a nurse outside of the US. I went to Haiti in 2016 and did rural medical outreach there. In 2017, I did a short notice deployment to Houston, Texas for Hurricane Harvey. 2018, I went to Kenya and did some HIV outreach and also some tuberculosis and maternal health things there. And 2018 was my first big stint, and I went to Laos, which is a tiny country in Southeast Asia beside Vietnam, and I worked at a children's hospital there for about 2 months. The next year, I went to the second largest refugee camp in Greece, which is located on a small island called Samos, and I was there for I think about 3 months, 2 or 3 months. Came back to the States, did another hurricane deployment when Dorian hit the Bahamas. So that was really interesting. And then last year, I was laid off as a pediatric travel nurse because I think everyone that's peds knows that our world kind of went crazy. And I deployed with COVID Care Force to Navajo Nation, the reservation, and I ended up staying there for 7 months working as a public health nurse through their COVID crisis response, which was insane and probably where I learned the most of all of them. So yeah, I'm excited to chat about it with y'all. And there are some nice pictures of some of the work I've done. The one with the baby is in Greece. The PPE is obviously COVID on the reservation. And then there's me forcing a child to take medication in Haiti.
Awesome. Well, hi guys. My name is Kenedy Dawson. So I'm coming on as I was Director of Volunteer Management at COVID Care Force. So I've got my master's in public health with a public health leadership concentration from University of North Carolina, Chapel Hill, go Heels. And my main experience in the public health world, I came into the public health world kind of as COVID was hitting. So it was a great time to be a public health professional. Not a great time for, the world in general, but I came on, kind of led COVID Care Force's volunteer programs, helped deploy over 100 teams of medical professionals to different hotspots, mainly in the Navajo Nation, in the US and Mexico. Very passionate about healthcare. I've worked in healthcare for a couple of years, and I'm actually, right now, I am starting my first year of medical school. So I'm in orientation as we speak, trying to learn all the things. And then just fun facts, I'm a big soccer fan. I played in college. My husband's name is Britton. We've been married for 4 years. He is a theology teacher. And then we have a golden doodle named Blue, who is quite adorable. And then you can go to the next slide. So just some background about me. Like I said, I've got my master's in public health from UNC. So my husband actually went to Duke, so that's him in the picture with me. So we were rivals for a couple of years while we both got our grad degrees. Joined the COVID Care Force team in May of 2020. So it was kind of in its infancy, just starting out. So I helped create our volunteer program, and I learned so much through that job, just working with the Navajo Nation, working with Indian Health Services for a little over a year. I worked in healthcare for about 4 years. And like I said, the picture at the bottom left is my medical school. So that was when we moved here and I'm currently in Joplin, Missouri. So I'm super excited to talk to you guys about this. Very passionate about this topic, and I'm really excited.
Okay, so I think what everyone's big question is like, what is medical volunteering? And I think that question has a very broad answer. But the official definition is volunteering your time and skills as a healthcare worker to an identified need with an organization. So I think it's really important. Which organization you work with is probably one of the most important things, and what causes you're identifying to use your skills to help treat. And there are multiple different types of medical volunteering. This is just a very broad overview of that. So disaster response is one big one. That's me in Houston when I deployed with Heart to Heart International. I think this is a great opportunity for nurses that are probably have a little bit more flexible timeline. There's lots of NGO. So NGO means non-government organization. There's lots of NGOs that will have like an emergency deployment roster, and you can sign on as a nurse, join that roster, go ahead and like upload your nursing license, your BLS, you know, your ACLS, all those compliance things we have to keep up with, your vaccines, and all that. Go ahead and have that on record, and you're just on their emergency roster. And so when hurricanes are pretty much the biggest source of these kind of deployments. But any kind of natural disaster hits, they can reach out to their roster, say, hey, you know, are you available to deploy? And when they mean deploy, they mean get on a plane in the next 48 hours and be able to commit to usually 14 days. Are you available? And you can just say, yes, send me. Not cool, no worries. There's usually no time commitment with those, but I think those are a really good opportunity to get started with. And it's always good to be able to have all of your ducks in a row and have your compliance stuff so that you can just hit the ground running. They can buy you a plane ticket. So you can always just reach out and research for hurricane or disaster response organizations, and a ton will come up like this. Mm-hmm. And then ongoing projects is probably the biggest part of global health. And that's a very broad topic again. Those are usually, you know, need volunteers to come on a rotating basis, deploy teams, and they pretty much always commit to at least 14 days, at least, usually longer. I've gone places for months, gone places for 14 days, gone places for 7 months. But this is kind of projects that are intended to better community. So a lot of these are what I like to call what people consider less exciting. The emergency response are kind of disaster, go in, hit the ground. These are the, you know, boring things like hypertension management and maternal health that I love, all public health and global nursing things. Kenedy can probably explain that a lot better than I can, so I'm gonna let her take over.
Yeah, so the ongoing projects is, I'm mostly familiar with this. This is kind of what we did with my work at COVID Care Force. So if you're looking for a volunteer opportunity that is a little more, it could be like, I mean low stakes as in not the adrenaline rush of hopping on a plane in 48 hours. Like I'm a very type A planner myself, so that would kind of stress me out to be my first experience. So this is a good way to kind of get your feet wet. Like Tayler said, it is very normal for most organizations, which we did this, to ask for 14-day commitment minimum. And that's mainly because on the organization's end, it's expensive to send y'all to a place like this, because a lot of times like they'll pay your way or pay most of your way, if not the whole thing. And so if we can't, we try to get at least a 14-day commitment so that we can, you know, keep a good team going and it's not in and out, because it takes a minute to train everybody. So These are things that we're going to talk about, like a lot of the ethical implications and kind of that whole area in another section. I know there was a lot of questions about that, but yeah, this is going to be very public health focused, very global health focused, focusing on like the sustainability of health outcomes for communities, vaccinations, things like that that are going to be managing more of the chronic diseases as opposed to the disaster relief, which is going to be like whatever you get is what you get. This, you have a little more preparation for, I think, an ongoing project like this.
Description. I think I'll add, just from the nursing standpoint, I witnessed when we were on the ground in Navajo Nation for like 7 months, I realized what, like, it's expensive and it's also kind of a logistical nightmare to have volunteers coming and going. So try to be mindful of that when you work with an organization, and they have reasons why, they have rules of when they send teams in, when they take teams out, because it's a ton of moving parts.
I can talk about this one if you want.
Yeah, I'll let you take over this.
So, okay, there are paid and unpaid volunteer opportunities. So I will explain. So you're probably more familiar with the unpaid because that's what you think of when you think of volunteer opportunity. You go, you don't earn any money from it. You're just going to use your skills to serve a community that is in need. Now, on the backside of that, there are some paid opportunities. And when I say paid, I want to be clear about this. I'm not meaning paid for like your work or your expertise. I'm meaning you get paid so that you can keep paying your rent or your mortgage back home while you're volunteering. So when you're thinking of a paid volunteer opportunity, it's not a job. You're not going to be paid competitively. It's really just like COVID Care Force had a couple of these opportunities where we would pay volunteers who were there for an extended period of time. You had to commit for 1 to 3 months at a time. So the commitments are usually much longer if you're going to be paid. And we paid probably 50% of market rate for what a nurse would normally earn. And really the reason that we paid our volunteers is because spending an entire month away from your job or your contracts, what have you, it can be difficult, and we wanted to ease that burden so that people could just focus on serving rather than focus on the stress of paying the bills that are not going to stop because you're somewhere volunteering. So there are going to be opportunities like that sometimes, paid versus unpaid. But again, keep in mind, your purpose for being here is still to serve. So this is not a good time to be looking for a job or looking for like a competitive rate. That's more for your normal contracts that you're looking for in your employment. On the other side as well, with the unpaid, a lot of times most organizations will pay for your travel. And I think we talked about this a little bit in our Instagram live the other day, but a lot of organizations will pay for your travel, or at least your flight and your lodging and some food as well. That's totally normal. It is not normal for an organization to ask you to pay a $3,000 fee to go serve for 2 weeks. That's kind of a red flag. We'll talk about why when we get to kind of the ethical issues, but I don't know, Tayler, do you have anything to add more about like paid versus unpaid?
I'll just add, the majority of what I've done as an aid worker has been unpaid. And I think, like Kenedy said, it's really important to remember, because we come from the travel nurse world, and we are in travel nursing, we are paid for our labor. We are paid for our skills, and there's a market value for that we should demand a certain amount for. In the aid world, you are paid to be able to live. So when I've taken paid positions overseas, I mean, maybe like $200 a week is what we're talking, because it's just enough for you to live and basically not get paid. Like, I could buy food. And those are with organizations that paid for my flight over there and paid for my room and board, or put me up in a place after I committed to about 2 months. Because I mean, these are not-for-profit organizations, So and I have done aid work where they have not been able to pay for my flight. I've had to pay for my flight, and maybe they'll give me a place to stay and some food. But just keep in mind, we are not being paid for our skills in this world, and kind of turn off your travel nurse brain of negotiating contract. And remember that we are there to serve.
Mm-hmm. And yeah, and to differentiate, I saw a question come in about a red flag if an organization asks you to pay for, it's not a red flag if they ask you to pay for your own flight. It's more if they are asking you to pay for a very vague fee and you don't know what that money is going towards. So like if I said, I work for XYZ organization and we have a trip to, I don't know, you said the Bahamas coming up for a 2-week volunteer experience, and you will need to pay $3,500 to go on that trip. And that's all I told you. That should kind of be like ding ding red flag, because you want to know what's that money going towards? Why is the fee that much? Can you break down the cost of me going? If I said we have a trip that we're going to go to Mexico for 10 days. And unfortunately, we can't pay for your flight. We'll need you to pay for your flight. That's completely normal. And that's pretty common with some nonprofits as well, because I know from working in the nonprofit world, we don't have money and we wish we did. And if we did, we'd like to pay for everyone's everything. But it's more of the vague fees where you don't know why you're paying so much money. It's like you're paying for a service rather than paying for the logistical expenses to get you there, if that makes sense. Hopefully that makes a little bit of sense. Okay, good.
Yeah. I think, and Kenedy will talk about this later when we talk about volunteerism, because when I first started wanting to do aid work, I looked up medical missions, and it would be like $4,000 to go to Peru and work in a clinic for the experience. It's a great experience. But Kenedy will dive into that later. But yeah, it's definitely not a red flag if they're like, we can't afford to fly you out here, but we'd love to have you. And then buy your own flight. That's totally normal.
Yeah, we've got so much ethical stuff to talk about. We'll get to that. You're muted, Tayler.
Sorry. Okay.
There you go.
How to get started. I think how to get started, first of all, is getting, I don't know how to say this, your life, to a point where you can go for at least 2 weeks a month. That's probably the hardest part for most people, I think, is being able to work it into their work schedule. So that's where travel nursing is a great avenue for this. But I did a few things as a staff nurse. You just have to be able to plan it pretty well in advance, and obviously ask for time off and all of that stuff. Then I think you just need to take a deep look inside and figure out what you're passionate about. What cause are you passionate about? If you're an L&D nurse and like maternal health, then definitely look up things in that avenue. And just what do you want to address? Like, for example, I knew that I wanted to work with displaced populations and the refugee crisis that was happening. So I started researching, what medical NGOs are on the ground serving this refugee crisis, and start from there. And then you can start vetting organizations. So I think the biggest thing is deciding to get started and making your life available.
Mm-hmm.
And then I think, Kenedy, if you want to dive into like finding the right organizations, or is that?
Yeah. So, like she said, honestly, you're going to start with kind of figuring out what it is you want to do. There's a level of flexibility you'll have to have if you're going to volunteer, just because you just don't know what an organization is going to need you for. And so you might be a labor and delivery nurse, but we might need you to work with with kids and do pediatrics, and the organization will help you determine if that's something that you're able to do with your training. That's one of the ways you're working for the right organization, is they're supposed to guide you on this process. With COVID Care Force, I knew all of our volunteers pretty intimately. I talked to them on the phone. Like, I knew their backgrounds, and I knew what kind of backgrounds we could use in certain positions. So, like Tayler, when she volunteered for us, she did like pediatric oncology, and she worked on like heme floors and all that stuff, but we needed her for public health, but we also talked and chatted, and I know she could do it. And so the organization needs to be able to guide you so that you feel comfortable when you get there doing the job that they need you to do. I also think when you're looking for the right organization, they also need to be very clear with you on their expectations. You don't want to go in, there's some level, again, adaptability and flexibility are like the two key words to know as a medical volunteer. You're going to have to be adaptable. You're always going to have to be flexible. no matter what we do on the org side, no matter what you do being prepared on the volunteer side, something's going to change, and we just have to kind of roll with it. So if you're got to look for the right organization that can clarify the expectations of what they're going to need you to do, while also being honest about the kinds of changes that might happen. That's something that at least that I know I really tried to do in COVID Care Force with, especially with COVID, because the situation seemed to change on a weekly basis. And sometimes I would call volunteers and tell them, well, you're going to be working on their COVID floor, and like, you need to be prepared for that, all the stuff. And then I'd call them the next day and be like, actually, you're going to be doing nose swabbing because that's what they need now. And that's just the kind of thing that, one, it's totally okay for you to expect some level of communication. That's okay. You guys are totally fine to expect that from the organization, and also just understand that there's nothing we can do. And then I'm trying to think of just this kind of tips into the ethical stuff too, but organizations should be very transparent about their process and their mission, their financials, and also what their goal is and like who they're working with. I mean, I can't tell you, like, I would be so concerned if I volunteered for an organization where I never talked to anyone in the local community when I was there. And like, I was in this little organizational bubble, if you will. Like, that's a major red flag, because then we get into the issue of, are they really helping out the community and doing what needs to be done? Or are they kind of doing what makes them feel good and getting, quote, the experience, but you're not actually doing anything to help, if that makes sense. So lots of different ways to be looking for the right organizations. Transparency is key. Communication is key, and making sure that you understand what you're signing up for. All of that, super important. Oh, good. Perfect. I forgot we had this slide. Okay, these are our golden rules, the do's and don'ts. So we're going to talk at length about volunteerism in a minute, but you want to try to avoid that. That kind of goes back to making sure that the organization is clear on their mission, and they are sending you on some kind of volunteer trip that is sustainable for the community that you're helping. That's something you want to look for. We'll get into that a little bit more. Definitely read their mission statement. That should be very clear. Financial statements as well. This is kind of along the lines of what we talked about a few minutes earlier about how if you're paying like a weird fee for, quote, an experience, you're going to pay $4,000 to go to Peru, then what's your $4,000 going to? You should absolutely know that, and that's because that's your money. I mean, that should be something that they should disclose to you. I don't know, Taylor, do you have anything to add about financial statements or anything like that?
No, I think you're doing a great job covering all that. I think it's a requirement of an NGO that if it's a legitimate NGO, that their financial statements like should always be very visible. Is that right?
Yes, there is, like, I know they have to be at least like a year old. It's kind of based on like your taxes from the year before. So if there's like, for COVID Care Force, we didn't have anything for a little bit because we were so new. We hadn't filed taxes yet. So once they file taxes, then yes, it should be made available. And a lot of times organizations will send out like annual reports that kind of highlight what they've spent their money on.
And I think, and this is just me coming from a very like simple perspective, a lot of times, even just if you're going to their website and if it's .org, then it's, you know, they have for you kind of a licensed organization. If it's a .com setup, then that's usually like a travel agency company that's like selling an experience. And I've learned that just by looking over things. So that's just a good tip to use.
Yeah, and checking if they are a 501c3, like nonprofit status, that is also really helpful and important. I don't know if there's like a good way to kind of filter through, but yeah, the .org is really good. Being able to look up their 501c3 status, that's a good tip as well. I'll go to the next slide. All right, this is, I think Taylor has actually probably volunteered with a few of these. So these are just some organizations that we know of for people who are new, who are kind of getting into the world of volunteering. Like Tayler talked about earlier, these are going to send you on more of the disaster deployments. So if that's what you're looking for, these are some good examples.
I think I'm just going to throw in here because I think a lot of people asked in the question before about how to find short-term opportunities. I'm just going to throw in that remote area medical at the bottom. They have like mobile pop-up clinics all over the US. They're usually like just a weekend long, and you can just go. I think they'll even cover your hotel. They're just weekend pop-up clinics that you can go to and volunteer and then go back home. So that's a great opportunity if you want to get started for short-term opportunities. And then that DMAT is actually like, most of what we're talking about here are non-government organizations. DMAT is a government organization, but it's a really good way to get started and have your expenses covered. So I was just going to throw that in there.
Yeah. And isn't, I might be wrong, but I think Team Rubicon is associated with vets for people who have served in the military of some kind.
Yeah, that's right.
Okay.
I know, I don't remember I don't think you have to be a vet to work with them, but it was definitely like founded by vets, and they're very much military based, and they're like logistics and their mission, and they kind of do a little bit more intense things. Team Rubicon's probably not a good one to start with. They do some pretty intense stuff. So
they do.
Yeah, I think it is military based.
And Heart to Heart, so the Dr. Morsch is who founded Heart to Heart. He's the same person who founded COVID Care Force, which is the company that I worked for. So I'm obviously gonna like, yay, Heart to Heart. They do a lot of disaster deployments. I mean, if there's a hurricane, you can guarantee that Heart to Heart will be there. So if you want to go help on any natural disaster like that, Heart to Heart will be there.
My hurricane deployments were with Project Hope and Heart to Heart International. They're great organizations for disasters.
This one is more of the ongoing, which I'm going to talk about COVID Care Force just because that's where I'm from. So COVID Care Force has the / Global Care Force because right now, obviously, I mean, we've kind of got the Delta variant that's creeping up a little bit, but the kind of initial disaster phase of COVID has kind of dwindled down. Thankfully, we're not like in the place we were last summer of 2020. So what COVID Care Force is doing, we are still doing those same projects, helping out with COVID, still sending volunteers in areas of need, but we are also going to be making the transition to Global Care Force. So in the future, that will be a place where we are hoping to do some international mission work, some mission work in the States, and we will hopefully be still continuing our relationship with the Navajo Nation and with Indian Health Services. So lots of new projects will be in the works, but those are going to be ongoing causes. Those are things that you can schedule out a little bit more in advance. So if you can't volunteer this month or next month, but maybe in September you can, then these are good places to go because you can kind of schedule something far in advance.
Like Kenedy said, these are organizations that are addressing problems that aren't going anywhere. Like the refugee crisis isn't going anywhere, unfortunately. I'll just throw in Friends Without a Border is where I worked. They founded a pediatric hospital in Cambodia, but there's no longer sending volunteers. And now they're working on a pediatric hospital in Laos. So there were a lot of questions about like, I only have pediatric experience. Peds and NICU people, Friends Without a Border is a great place to get started. You'll exclusively be working with kids, which is pretty rare. Medequality and Refugee Health Alliance are addressing the refugee crisis. And then Global Response Management does everything. It's a big NGO.
So we're going to kind of jump into the ethics a little bit. So if you have any questions as I'm going, just pop them in because I'm able to like see some of them, but we can go ahead and go to the next slide. So main ethical decisions. So obviously when we are going to volunteer and we're going to help a community that is in need, we have to consider how to do that in a way that is ethical and sustainable and in a way that is actually helping the community, not just a like project that makes you feel good and feel all warm and fuzzy inside. That's not really, we're kind of done with that. That's not really what the point is anymore. So just some general considerations for any volunteer. You want to think about sustainability. Is the project that you are helping with sustainable for the community? When you are volunteering, are you like, can you see how this might cause problems for the economy, or would it cause problems for future healthcare, or is what you're doing actually going to help them improve with time, even after you leave? So it's really important to be thinking when you're there on your first day, you want to be thinking about how your actions during those 14 days or that month, however long, are going to impact the community for months and months and years down the road. Number two, obviously, everyone here is a nurse. I mean, not me, but I'm going to medical school, so do no harm. That's just what we do as healthcare professionals. I mean, you don't want to cause any harm while you're there. And one of the things that I saw a lot of our volunteers learn in the Navajo Nation was that the way that you've always done it may not be wrong, but it's might not be right for that community either. And if you're going to push forward with your habits and the way that you've always done things in a new community, that's doing harm. So that doesn't, and even though you're not technically doing anything wrong, if that makes sense. So we want to keep that in mind, be thinking about what's the mission and long-term goal. That kind of ties back to sustainability. And then obviously always practicing within your scope and skill set. And like I mentioned with some of the like how to pick an organization, the organization you're volunteering with, they should know enough about what volunteering like tasks you're going to be doing to be able to help you decide if you're unsure whether this is in your skill set. And that should be something you should be able to have a conversation with them, because you probably will be pushed out of your comfort zone a little bit, but no organization should ever push you to the point of not being safe with patients.
Great job describing that, Kenedy. I'm just going to add a few things. I think how Kenedy was talking about, and I think we can all come back our travel nurse brain and how off-putting it is when you walk into a new travel assignment and there's a travel nurse there. It's like, well, this isn't how we did it at my old hospital. And just think about how that makes that's so off-putting. So imagine coming into a community that's, has customs and has things that they do and medical practices that we're probably not used to. And we're like, well, that's not how we did in America. Don't do that. Don't be that person. I think I've learned throughout aid work, my biggest thought now and biggest consideration is what is the impact of me leaving here? When I leave here, what impact is that going to have? Because that's something to consider too. One of my favorite organizations and projects that I've ever been a part of is Friends Without a Border. Their whole model is, okay, we as outside funding are going to come into this poorly developed nation with very poor health infrastructure. We're going to use our money to build a hospital and staff it. And then for 10 years, we're going to bring volunteers in to train the Lao nurses and the Lao doctors. And then at the end of 10 years, we're going to leave. So that leaves them with a sustainable hospital that will be able to provide medical aid to the locals. It allowed for us to be able to help Lao nurses earn a living, Lao doctors earn a living, be sustainable. And them leaving did not have a negative impact. So that's truly investing in a community, in people. And I think that's a great model. And then I'll just add, always practice within your scope and skill set. I think it's easy to not do that because you're in places that have virtually no regulation. I've gone into places and asked, can you help perform this surgery? And if I had said yes, there's nothing is going to happen like in America when it's so regulated that if you do things you're not allowed to, there's consequences to that. So don't think just because you're in a third world country or developing world that you can just do things that you would not do in America. That is doing harm. That's all I have to add.
Yeah, that's great. We can go to the next one. Okay, so this is something we can't talk about medical volunteering or really volunteering of any kind without talking about white saviorism. And I want to first acknowledge the fact that this is something that even as Tayler, who is an experienced travel nurse and a very experienced medical volunteer, and myself, who is a public health professional, and worked with an NGO, we are still coming from the privileged perspective of two white women. So we're never going to be able to understand this or really explain it as best as we could, but we can't talk about this without one, acknowledging our privilege that we even have being able to talk about this. So I want to start with that and just talk about what white saviorism is and just kind of go through that a little bit, because it's a good amount to unpack. So in a nutshell, like the simplest definition I can give you for white saviorism is, it is when people with a privileged background, which typically that is white people, but any kind of privileged background, they go into a new country, a new culture, a new community, and they try to, quote, fix problems that are happening in the community. But they do that, and it's typically communities of color, and they do that without actually understanding that community's experience and without understanding their needs. There's a lot of ways that can go terribly wrong very quickly. And that's something that white people and people with privilege have made a habit of doing. And I'm sure you can think of like the token picture of the volunteer in Africa that's the one white person with the whole rest of the community surrounding them. Like that's kind of like the mental picture you get in your head when we're talking about this. But it's a very big topic, and we'd be wrong to continue without discussing it. We can actually go to the next slide. So there's a couple ways that we can talk through kind of how to avoid it. So obviously, number one is to acknowledge and check your own privilege. Just by living in the United States, just by having an education, a lot of times your race, your ethnicity, your background, there's millions of ways that you can acknowledge and check your own individual privilege. And part of that, as well as acknowledging your implicit biases. And I'm sure that nearly everyone here has probably had some sort of training on implicit biases at some point in their life. But the way that I describe an implicit bias is that's basically like a blind spot that you don't even know you have. So we're going to do a very short exercise. So there's a story about a father and a son who are driving to a baseball game. And both the father and the son get in a terribly bad car accident. The father dies on impact, and the son is really injured, and he's being rushed to the emergency room. He needs surgery. He's very hurt. And the doctor immediately looks at the son who was brought in, and they say, "Oh, that's my son." And when the surgeon came to bring them in, they said, "Oh, that's my son." So think to yourself, how would you explain that situation where the son that was being brought in that needed surgery died with his father on impact in a car accident, but then the surgeon said, "Oh, that's my son"? So think about it. 5 seconds. I'll tell you the way that I answered this, because it was very funny given my background. So I did this exercise with one of my mentors, and the way that I tried to explain it, I was like, I thought I was being really like woke pretty much in my response. And I was like, oh, well, they must have two dads. Like that's normal, they must have two dads. And I was like, that's the way that it like, and I was like, or maybe it's a step parent. And it's like, they're like, he has two sets of parents, like thinking I thought I was being inclusive. And then what my mentor told me is that the surgeon was actually his mother, which that was my own implicit bias. And that kills me, because I'm a first-year medical student wanting to go into surgery, and I'm a woman. And even knowing all that, even wanting to like buck that system as hard as I can, I still have the implicit bias that a surgeon is a white male, because that's what my mental picture was, whether I liked it or not. So use that. Enjoy the story of testing your implicit biases, but those are things that you want to think about. Think about what your blind spots are, because obviously, even though I don't want to have that blind spot, I do. I have that blind spot of, well, a surgeon's a man. A surgeon is not a woman, when I full and well am expecting to be a female surgeon someday. So that's probably the most important part. Just acknowledge your own implicit biases about wherever you're going. Number 2, listen first, act second. The reason this is important is because we just talked about that the definition of white saviorism is when you're going in to fix a problem without actually understanding the community's needs. And the way that happens is when you are acting first, then you're listening, or you're not listening at all. And what you don't want to do is you do not need to position yourself as the hero. You're not coming in to be the hero. And again, that's your saviorism kind of happening. So listen first to what the community needs, listen first to what they can provide, and then act based on what you've heard from the community. Because again, it's probably going to be different than what you've experienced, and that's totally okay. Number 3 would be reflect and inside yourself on the difference between compassion and pity, because there is a big difference. When you are feeling compassion for someone, you are feeling their pain in your heart, and you're feeling the burden of their pain. And compassion tends to come from a level playing field, whereas pity tends to come from a hierarchical perspective if you are taking pity on someone. And it's good to feel compassion when you go. I mean, some of these medical missions trips that you guys will go on and these volunteering trips, they will wreck you. And that's fine. That's good. They will absolutely wreck you. And you will just come back and be like, what is the world? What is this world we live in? And that is totally okay. And that's great. That's a good experience for you to have. But keep in mind when you're feeling compassion versus when you're just feeling pity. Because if you go on a medical volunteering trip and you come back and the lesson that you say is, oh, wow, well, what I got out of that was I'm so happy to be an American. How lucky am I? You have totally missed the point. You've totally missed the point of everything that you were supposed to learn, because you just spent the whole time feeling pity that was based on your privilege or your white privilege. And communities don't need your pity based on your white privilege. They don't need that. They need your compassion, and they need your ability they need your skill set, and they need your help. But just keep that in mind. It's easy to go one way or the other, and it's easy to think you're feeling compassion when you're actually feeling pity. So if you keep that in the front of your mind and remember that. And then we've talked about this a lot, but because it's super important, focus on sustainability efforts. You want to work with the community, not in your own little bubble. On your day 1, think about how, just like Tayler said this really well earlier, on your day 1, think about how every action that you do will affect day 1000. And think about how that will affect everything moving on after the time that you were there. So support locally owned businesses. Do not, because some things you can do might uproot someone's life, like their business and their life unintentionally. So it's a big conversation, but I could go on forever, and I'm going to stop early so we have time for questions.
Covered everything. I'm always saying you should start a podcast because I love hearing you speak so eloquently about it. I think everything Kenedy said, and just remember, you might not always be working with the most desirable populations and desirable problems. And I remember on Navajo Nation, I kind of ripped into a volunteer because they talked about, these people should be so grateful that we're here helping them. And coming from a place of hierarchy of like, they should be, bending over backwards, thanking us for being here. And I could go on about that forever, but do not have that mindset. You're going to be dealing with problems you don't want to, and problems that you're like, why can't this get fixed? But don't have that mindset. And preparing for your trip. Visas, I could talk about. I actually can't talk about it because I don't know, but it can be really complicated. Just my thing is like, make sure you have that worked out. They don't care if you're there doing aid work, being a good person. Have your visas worked out. I got detained in Vietnam at the border and spent a night in like a jail cell because of visa problems. So have that worked out. Vaccinations, doesn't matter your opinion on them. If a country requires it, you have to get it. They will ask you at the border. I've had the yellow fever, and I've had a lot of other crazy ones. Malaria, yeah. it doesn't matter your opinion. There's no religious exemption. You can't get your doctor to write you out of it. If a country wants you to get vaccinated, get it. Packing, pack light is my only advice. Have like some staples, some like, staple clothing that can be very versatile. I think scrub pants are great, and I wear them like even when I'm not working. Yeah, I can answer specific questions about packing, but you want like a good backpack, I think is best. Cultural norms and language. I think Kenedy dived into all that with like ethics. If you travel abroad and go do things abroad, you were going to see so many things that are just like, what the hell? Like, crazy, and just roll with it. I think a lot of people travel and it has this expectation of like, well, no one spoke English there. And it's like, well, people don't come here and are upset about that no one speaks their language. But I get that feedback a lot of like, oh, I would visit, but no one speaks English there. Like, don't have that expectation of them to speak English. Half of doing this is like immersing yourself in the cultures and the interacting with the people you're there with. So make sure you take time to explore and dive into the local cultures. Safety. Sorry. I'm probably not the best person to speak about this. I tend to live for the experiences and not have safety in the brain. But I think people have this mindset of aid work that it's like so dangerous and you're going to like such these dangerous situations. That's not always the case. That's rarely the case. Doctors Without Borders does some pretty dangerous stuff, and they have a lot of training for that. But for the most part, I think people need to remember that statistically, a lot of the US cities that we live in, you're more likely to have something bad happen to you than like where I was in Southeast Asia. And a lot of it's just like basic tourist safety things, like be mindful of your bag. If you're a white person in an area where no one else is white, you stand out. And they know that you're probably not from there. They know you probably have money on you. So just honestly, common sense goes a long way with that. And a lot of research will make you feel better and will make you more safe when you're there. So I think, sorry, I just dived through all that, but I can answer any specific questions that people have.
That was great. The org will usually tell you what kind of vaccinations you need to go to a certain country too. So you won't be like, it won't be up to your own research. Like they will help facilitate this for you.
Yeah. That's another part of like finding a good organization is how well do they prepare you to succeed there, and how much support will they give you when you're on the ground. Yeah. Awesome. Okay, questions.
I'm back. Ladies, this has been great. I love it. So much good information. You're both crushing it over here. So let's see. I saw that we had a couple questions. I'm going to be y'all's Vanna White over here and feed you questions. Let's start off with this one. We'll go back to the beginning. Jennifer asked, are there any organizations that don't charge anything to volunteer? Organizations that pay plane ticket, meals, etc.?
Yeah, lots. Pretty much all of the disaster deployments, they will cover your flights. I'm gonna see if I can share my screen. Oh.
I'll stop sharing mine then. Let me stop sharing.
Sorry.
No worries.
Sorry, y'all.
No worries. We got nothing but time.
Can you see that?
Yeah, I can see your whole screen. Just by the way, maybe maximum. It's just.
Okay, you can see that international medical volunteering, linking volunteers and NGOs. Okay, I would encourage everyone to join this Facebook group. It's not monitored or anything. It's kind of like the Gypsy Nurse Travel Nurse Facebook group, but it's a great resource because I think if you ask for organizations, we could sit here for hours and there's literally thousands. But I've gotten plenty of aid work just by going on here, posting like, hey, I'm an RN. I'm available these dates. Who can use me? And also who can pay for my flight and stuff. So I think starting there would be a great point.
If you want to remind me, I can share that in the email afterwards.
Okay.
So we're gonna send out the recording and the slides after the fact, after we finish up here. It just takes me a little bit of time to get it uploaded to YouTube, so probably tomorrow morning. If you have any other resources that you both want to share with them, that'd be perfect. We can include it in that email, but that's a great one. So just remind me to include that. Let's see. In Q&A, I saw another one. I was curious about this myself. John asked, onboarding process. Is it for a new travel agency? Address history, work history, references, screening, criminal background, etc.
I'll let Kenedy speak to that because she works on that end of it. I will say, in my experience, it's very different how extensive it is if you're working with a U.S. organization within the U.S. or if you're going overseas. But I'll let Kenedy speak to that.
Yes, and the short answer is it depends. So we kind of had both ends of the spectrum at COVID Care Force, where I would say overall, we had an abbreviated version of like a normal hospital onboarding process, even at most. For disaster stuff, you're not really going to get that much of an onboarding process. You're going to get very brief. It's going to be like real quick. For something that's a little more long-term, yeah, if it's in the US with a US-based organization and you're working in a hospital, that's probably the most paperwork that you'll have to do, and it would probably be similar, but they're not going to need as many things, I think, as like full-time, like full unemployment would. We had some places that needed like a good amount of that, and the main things we needed were just like your work history, but only a few years back, and then vaccines, and we never did references or anything. And then the minimum was needing nothing, because we've got one of our current projects is with the Missionaries of Charity in Tijuana, Mexico. We personally will check your license just to make sure that you are who you say you are and that you're okay to be a medical volunteer. But as far as you could walk in and say you're anything and they'd believe you. So, because they don't check anything, because it's just kind of in the middle of nowhere, Tijuana, and they'll just take whatever help they can get. So for that, we take like minimal paperwork. So it really depends. Abroad is going to be totally different. I don't have a lot of experience with that.
Say short answer, no, it's definitely not as extensive as a travel contract. It's definitely not all that. On both ends, the most I've ever had to do was with COVID Care Force, because I was going to be working in a U.S. hospital. So all the requirements that the U.S. hospitals have for travelers, basically, they also had for us. On the other end of that, when I was working in the refugee camp, they just asked for literally a picture of my U.S. nursing license, and okay, cool, like come start. It's more the vaccinations and stuff is more like whatever country you're going to be in. But most overseas organizations, it's not a lot.
Yeah.
Awesome. Thanks, ladies. Would one of you, actually, Tayler, would you mind throwing in the chat? Someone asked again about the Facebook group that you shared. Would you mind throwing in the chat really quick?
Yeah.
And I am we can move on to the next question. Let's see. So do you need a passport? Mine was stolen as in my state. I'm assuming if you're traveling internationally, you're going to need your passport, but Kenedy, you probably Tayler have some thoughts there as well.
Yeah, if you're going anywhere out of the country, you need your passport. You don't need it. We didn't need it if you were staying in the US, but anywhere else, you'll need it. And
I would also throw in, from personal experience, have someone in the US needs to have a copy of your passport. Whoever that is, someone needs to have just a paper copy of it, and you should have a paper copy of it kept separately from your passport. It is not a good situation to get caught overseas when yours is stolen or lost. So someone in America, and you need to have another one.
That's really good advice. I've actually lost my passport.
That is good advice.
Yeah, and especially like when you're working in kind of non-desirable areas, like they're not used to tourists coming and going. So someone in America needs to have it, and you need to have a separate copy.
Thanks. So Nicolette asked or said, I was able to sneak in here as a current BSN student. Well, all nursing students are welcome to events, so welcome. Yeah. Do you know if any of these organizations need help from students?
I know remote area medical takes students. Yeah, a ton will take students. And I'll let Kenedy speak to that. I think COVID but a ton will.
Yeah, COVID Care Force has in the past. I think right now we don't have, right now as a nursing student, you might be able to go to Tijuana with us if you wanted to. You can sign up on our website. I'll throw it in the chat. But there are some organizations that will have limited opportunities for students. That's pretty normal. I'm trying to think of what else. We've had students help with vaccinations as well when we were kind of helping with the COVID vaccination effort. A lot of times so correct me if I'm wrong about nursing school. When you get to like the end, you can pass certain skills. Is that correct? A lot of times there's some select opportunities where if you're able to prove that you passed a certain skill, you're able to do more. That's very variable. And I would say most of your abroad stuff, you're probably gonna have to be licensed. Yes. Yeah. You're able to do vaccines. Yep. So it just kind of depends on what you're looking for. We had a lot of nursing students do public health nursing as well helping with contact tracing, which is some of what Tayler did.
Yeah, and I think it really depends on like what the organization is doing. Like when I was in Lao, I was doing like critical care things. So no. But I mean, there's a ton of like, vaccination sites and just like remote clinics when you're just taking blood pressures and doing wound care. Yeah, they'll definitely take students.
Okay, perfect. We have time for just a couple more questions. Carla asks, these organizations have contingency plans for if their volunteers get injured/sick while working? I assume we would be taken care of, but not sure if that information is published online.
Don't assume that.
Yeah.
If it's a big organization and they're like, really well established, like I actually got blood from a gunshot wound in my eye when I was with Heart to Heart International, and they have like a whole insurance thing, and they were able to help me with how to do a month of HIV meds, but that's a whole other story. But if you're going overseas and doing aid work, no, and don't assume that. And I would always recommend travel insurance for that.
Mm-hmm. Yeah, I would echo that. So most good organizations will have you sign a waiver of some kind, read it, like read the whole thing, because a lot of times that waiver will have, that's probably why it's not published online. But a lot of times if you're like getting through the process, they're going to have you sign some kind of a waiver that says they're not responsible if you get hurt or injured or something. And that waiver will probably be what has that information, because I know for like COVID Care Force, we had a waiver for volunteers to sign that said that they would not hold COVID Care Force responsible if they did get COVID. We did go the extra mile to have the hospitals help us take care of those people so that they wouldn't have, because they couldn't fly home, obviously. So but what we did was we went a little bit more than what a normal org would do because it was COVID and because of just like the nature of the situation.
Yeah.
Okay, awesome, thanks. And then real quick, Tayler, do you have a certification in public health?
Yes, through California. Okay. And that just entailed like being able to prove that I worked so many hours as a public health nurse. It's only through California. That's not like super established and like national, but that's just kind of like how we have, like I'm a certified pediatric nurse, kind of the same thing. So that just entailed proving that I've worked the hours. I do not feel it's necessary for volunteer work. I did it more for like my career as an RN in the States than I did for volunteer work. It's absolutely not necessary for that so it's not like, I wouldn't compare it to a master's in public health at all. That's what Kenedy has, and that's like a whole grad school degree. This was just our little certification.
Yeah, you don't need a master's in public health to volunteer. You're going to learn a lot about epidemiology and about health policy, and a lot of like, you can lead a team with a master's in public health, but you don't need it to just volunteer.
Yeah. A nursing degree, I feel like in this realm goes a long way.
Mm-hmm. Perfect. Awesome. Well, guys, I think we're right at the end of our time here, but I want to say a huge shout out to Kenedy and Tayler. This is a fantastic presentation and y'all did such a good job. Very warm and relatable. So thank you. And thank you to everyone who joined us tonight. I just want to share that we will be sending up a post-event survey. I would love if you guys would fill it out and let us know what you liked, what you didn't like. So that we know how to improve it for next time. So we really take all that feedback really seriously. So please complete that survey. Next week, we're actually doing an event all around aesthetic nursing. So a little bit of a deviation from tonight, but really interesting. And we're going to have an aesthetic nurse that's going to share kind of like what it's like and how to get involved or how to get into that part of nursing. So I would love to see you there. We will be sending the recording and slides out after this, so expect that probably tomorrow morning. And again, thank you all, and thank you to Kenedy and Tayler, and I hope I can see y'all at the next event.
Yeah. Thank you all so much for joining. I'm always happy to talk about this, or if you like need connections to organizations, you can find me on Instagram at Where's Tayler. I'm happy to chat about it. Thank you all so much for joining us.
Yes, feel free. Reach out, ask questions. I could talk about this all day. Thank you guys.
Same.
I'll make sure to include y'all's Instagrams handles in the email. So, all right, team, y'all have a great. Hopefully, I'll see you next week.
All right.
Bye.
Thanks, y'all.